everyone, respected faculties and students. Myself, PARMAR SMIT. I am in second year Bachelor of Physiotherapy from Marwadi University, Rajkot. So today is my rubrics 2 video presentation, and our today's subject is Kinesiology. In Kinesiology, our topic is thoracic cage. So let's start first with introduction. The biomechanics of the thoracic cage forms a dynamic closed loop kinematic chain that balances respiratory mobility with structural spinal stability. Structurally composed of 12 thoracic vertebrae, 12 pairs of ribs, and the sternum. This mechanical complex expands and contracts across three-dimensional planes to drive pulmonary ventilation while acting as a critical rigid stabilizer from the upper body trunk. The thoracic cage consists of first 12 thoracic vertebrae T1 to T12 posteriorly, second 12 pairs of ribs, 24 ribs total, third one sternum, breastbone anteriorly, first manubrium, second body, and third one is xiphoid process, fourth costal cartilages connecting ribs to the sternum. Kinematics of respiration. During inhalation, muscular force expands the volume of the thoracic cavity in three dimensions: anterior, posterior, transverse, and vertical, creating a negative pressure gradient that draws air into the lungs. This is achieved through two highly distinct rib movements. Kinematics of respiration. Pump handle motion. Ribs 1 to 7 predominantly occurs in the upper true ribs. The rotation axis is oriented near the frontal plane, driving the anterior rib portions and sternum upward and forward in the sagittal plane. This mechanical action primarily expands the anterior-posterior diameter of the chest. So we can see the pump handle movement, superior and interior movements of sternum. So this is work as a pump handle motion. Bucket handle motion, ribs 8 to 10 primarily occurs in the lower false ribs because their axis of rotation aligns closer to the sagittal plane. These ribs swing upward and laterally in the frontal plane. This mechanical action mainly increases the transverse diameter of the lower chest. So this is work as the bucket handle motion, like elevation of lateral shaft of ribs. Kinematic of respiration. Calibrate design motion. Ribs 11-12 characterized by the floating ribs which lack anterior attachments. They move backward and downward to depress the thoracic floor and stabilize the attachments of the dipping diaphragm. Joint articulation and constrictions. The movement of each thoracic segment relies on a complex network of 13 separate joint connections working in a synchrony per functional thoracic ring, costovertebral and costotransverse joint from the posterior anchor points connecting the rib head and tubercle to the vertebra. They detect the precise axis of rotation for the rib during movement. So we can see also here costovertebral, costotransverse joint location, costochondral joint location, and sphincteral plus posterior anterior translation. Joint articulation and constrictions. Sternocostal and costochondral joints connect the anterior aspect of the ribs to the sternum. The palpable costal cartilage provides essential material, elasticity, strong potential energy during active inspiration that facilitate effortless passive recoil during expiration. Classification of ribs. True ribs 1 to 7 attach directly to the sternum via their own costal cartilage. False ribs 8 to 10 attached indirectly through the cartilage of the rib above. Floating ribs 11-12 no anterior attachment to the sternum. Function of the thoracic cage. First, protects heart, lungs, great blood vessels, protection of liver, spleen and kidneys. Function of the thoracic cage in second, respiration. Provides attachment and movement for respiratory muscles, diaphragm, intercostal muscles, accessory breathing muscles. Support and posture. Supports the shoulder girdle, helps maintain upright posture, serves as a foundation for upper limb movements. Fourth, muscle attachment. Many muscles attach to the thoracic cage, including pectoralis major and minor, serratus anterior, intercostals, diaphragm, latissimus dorsi, trapezius. Joints of thoracic cage: costovertebral joint between ribs and thoracic vertebrae, costotransverse joint between rib tubercles and transverse processes. Joints of the thoracic cage in sternocostal joint between ribs and sternum, costochondral joints between ribs and costal cartilage. These joints allow the thoracic cage to expand and contract during breathing. So this is all about of the thoracic cage. So I hope you can understand easily and clearly. Thank you.